So we're looking for the vascular assessment now, so I'm looking at the skin. So the skin colour is good and looks normal, there's no abnormalities or signs of ischemia or cyanosis. The temperature gradient as we run down towards the toes, it starts warmer and gets ever so slightly cooler, that's normal. If we have a temperature gradient where there's a big difference between them, we'll be having concerns. Everything looks quite normal, so we'll try and palpate the pulses. So we'll try dorsales pedis first. If I take 3 fingers and pop in the cleft between the first and second toe, and then 3 fingers again, and press ever so gently, I should find it. And there it is there, nice and strong. So it's just I found it with those 2 fingers there. So I found it, and that's all we need to do. We'll come to the other foot and we'll do the same process. There's a dress in here, but it shouldn't be in the way. So the cleft of the toe, 3 fingers, and then up 3 fingers again, and press gently. We're pressing gently because this is quite a small blood vessel. And if we press too hard, we can actually occlude it. And I'll just move it, and there we go, we feel it there. And don't worry, sometimes this runs deep. 20% of people, this anatomically runs deep, so you can't find it. It doesn't mean it's clinically significant unless it's associated with other issues that we find. So if we move on to tibialis posterior, if you can just rotate your leg for me. All we're going to do is we're going to find the bony prominence here, is the medial malleolus. We're going to cup it around with the same 3 fingers, just press into the dent there. There's a good strong pulse there. So that's present, so I'm quite happy with that. I'm going to use my other hand now, so we can just rotate it again, find the bony prominence, the medial malleolus, and press into the dent and just feel with my 3 fingers, and there's a good strong pulse. So the pulses are palpable, and I'm quite happy that the skin is in good condition. We've got little hairs present on the toes, which is a sign of a good blood supply, and that's fine. Okay, so if you close your eyes for me and just say yes every time you feel me touch it.
Yes. 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 Yes.
Okay, thank you. You can open your eyes again. Okay, you can close your eyes for me, we'll do the tune and fork test.
That's why I did. Instructors. Vibration. Instruct.
So if we just inspect the feet for foot deformity or any issues or wounds, so we can see that these feet are in generally good condition. There's no signs of a bunion. The toes are slightly retracted, but there's no signs of any hard skin or trauma. We've got a previous wound on the second toe, which isn't related to the diabetes. And there's a little bit of callus and hard skin. So with this client, I'd be recommending that we keep an eye on the feet, but not necessarily intervening with any sort of surgical footwear. The important thing for you is cream and moisturiser. You can see there's dry patches around your heels. The important trick for this is, if I grab your toes, everywhere else on your foot you can put cream. So any sort of emollient you have at home, you don't need to go and buy anything specific or expensive. It doesn't have to be posh foot cream, but something that's a moisturiser, that's all we need. And you can put it anywhere on your foot, but not near your toes. The reason I grab the toes is just to show you don't put the cream near them, because if the cream gets in between your toes, it can cause moisture and cause that skin to tear. So there's no need to go near the tops of the toes or in between the toes at all. But there's no signs of any foot deformity. The feet are in good condition. That's fine.